Nadia has more on the real reason your body might be wanting something very sweet. Nadia?
Well, are you someone who wants to cut down on carbs and sugars but keep going back because of cravings? Well, it turns out your body is probably trying to tell you something. Dr. Andrew Petersen of Holtorf Medical Group joins us now to tell us what might be going on. Okay, so unfortunately, I had a few brownies at my desk, so that was probably a sugar craving,
okay.
right? That's okay?
No, it probably was. I mean, it's the afternoon. It's the time of day when our cortisol starts to go down a little bit, and our brain says, boy, I need some fuel.
Yeah.
And so we eat sugar to boost that back up.
Okay, so when is it okay to have a little snack, and when might there be more of a problem?
We need carbohydrates. You know, carbohydrates come in simple forms and complex forms. So a complex carbohydrate comes from vegetables, fruits. Simple carbohydrates are from refined foods, like white flour, white rice. Starches are sort of a simple carbohydrate, like potatoes. There's not really a time when we need simple carbohydrates. They make us feel good.
Yeah.
They actually raise our serotonin a little bit, so they enhance our mood. They give us a burst of energy, but they're never necessarily good for us.
Okay. So that jar of candy I have on my desk, I don't need it.
No, it's nice. It's emotionally reassuring, but no, it's not healthy for us.
Okay, so when does this sugar craving kind of turn into too much yeast production?
Right. There's hormones, so that's the cortisol, the thyroid, estrogen, progesterone. When those are down, you'll crave sugar. But something that gets overlooked a lot is yeast. So if we have yeast, and yeast is all over in our environment, if we have lots of yeast, we'll crave lots of sugar because yeast lives on sugar. Anybody that's ever made bread knows that to make the bread rise, they have to add some sugar to the yeast. Now, if they made it with white flour, they don't have to do that. It'll rise on its own. And that's because the white flour is a very simple carbohydrate. It's a sugar.
Okay.
So yeast lives in our gut. That's where the food is. And it makes us crave sugar so that we will feed it.
I see.
There's lots of other symptoms of having lots of yeast.
It seems like a cycle then.
It is. It's a vicious cycle. If we ate more complex carbohydrates, vegetables, particularly slimy vegetables like okra or aloe vera, those feed the good bacteria. If we eat more simple sugars, that feeds the yeast. We want to feed the good bacteria because that helps us. We don't want to feed the yeast.
And yeast is something that we naturally have, but too much, just like too much of anything, can be a bad thing. So that would be. How does this connect with, I know there's probably women out there thinking of yeast infections. How does that connect?
Well, the yeast wants to live in our gut primarily because that's where the food is. But if the population of yeast in our gut is too high, it will find other places to live. There's still some sugar in our blood in other places. And so if the yeast has to move into the vaginal mucosa or the sinuses, it'll move there if it has to. So if you have a vaginal yeast infection recurring, you probably have a gut overgrowth of yeast. If you have recurrent urinary tract infections or sinus infections, that's a good indicator that you probably have a lot of gut yeast.
I'm assuming you want people to check with their physician if they have some of these problems. Are there things that they can do to kind of combat this on their own before having to take that step?
Yeah, absolutely. They can cut down on their sugar, and that's tough because they're craving it.
Yeah, how do you stop that craving and ignore the craving? You talked about slimy vegetables,
yeah,
right?
hormonally, the first thing to do is eat more protein.
Okay.
Because then your cortisol won't drop, so you won't have a cortisol-induced demand for sugar, like that afternoon, oh, I think I should have a brownie. That won't happen.
Okay.
So that'll help with the hormone side, and then you can start to eat less and less simple sugars and more complex sugars.
All right, so load up on the protein.
Load up on protein, load up on lots of good vegetables, particularly okra, and if you can eat those, eggplant. But any vegetable with lots of fiber is going to, soluble fiber will feed the good bacteria. That will crowd out the yeast and the sugar craving will go away.
We can win this battle against that sugar craving. That's what you just told me.
Absolutely.
I can be victorious.
Treating the yeast with a medication is sometimes very helpful and very important.
Dr. Petersen, thank you so much for joining us. We'll put some of that information on our website at forutah.com. Don?
Yeah, I might be eating the wrong